right, well, thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. We are thrilled that you are taking the time today to connect with the CU Anschutz alumni community and focus on your own wellness. I'm Dr. Andrew Maurer, and I am a nuclear pharmacy supervisor for Cardinal Health and a board member of the CU Skaggs School of Pharmacy Alumni Association. And I am honored to kick off this event tonight. For those of you attending your first Happy and Healthy Hour, this series was developed to provide practical tips to support your self-care as health professionals. This series has covered topics from sleep health to the positive effects of animal connections to burnout in healthcare professionals. Today, we bring our campus expertise on a topic that affects all of us, promoting a healthy 2021, vaccines and integrative health strategies against COVID-19. I now have the privilege of introducing tonight's speakers. So speaking first tonight is Dr. Wesley Neufer. And Dr. Wesley Neufer is an associate professor at the University of Colorado Skaggs School of Pharmacy. He is an assistant director of experiential programs where he works to place students in various pharmacy practice settings across their curriculum. Currently, Dr. Neufer is working on a variety of funded initiatives involving transforming community pharmacy practice to patient-centered care models. Dr. Neufer's experience is in experiential education, diabetes, obesity, and immunizations, and his clinical practice is in the endocrinology department at the University of Colorado Hospital. Speaking secondly tonight is Dr. Monika Nuffer, and Dr. Monika Nuffer is a clinical pharmacist with expertise in integrative medicine. She provides individualized consults where she evaluates and explains the safety and efficacy, as well as pros and cons of different herbs and supplements patients are taking or considering taking. Taking her patient's complete medication profile into account, she screens for interactions, duplications, and helps to optimize pharmacotherapy treatment at the Integrative Medicine Center. Dr. Neufer holds faculty appointments at the University of Colorado in both the Skaggs School of Pharmacy and the School of Medicine. She is the program coordinator of the new Integrative Health and Medicine online graduate certificate program and serves as the academic and experiential program coordinator for the distance degrees and programs. So with that, I'll turn it over to Dr. Wes Neufer.
Thank you, Andrew. I appreciate that introduction. Good evening, everybody. Thank you for joining us today. I cannot take credit for our lovely slides here. This was my my wife's doing, and I think they're very nice, and so you can credit her for them. However, she also has more than twice as my number of slides, so so I figured that she gets to choose which background we use. So what I'm going to talk about today is the COVID-19 vaccines and just kind of go over an overview. There's a ton of information out there about these vaccines. I will give you as much up-to-date information that I have. I have several friends that are working in this industry as well. And like I said, there's information everywhere. So I will give you as accurate of information as I have, but certainly I'm also going to give you some takeaway places where you can continue to get good information. And to start out with that, I would think that this is an excellent site. The link is down at the bottom here. This is a New York Times site, and I updated this just this morning, and you can see how many vaccines are actually in development across the world, which is pretty amazing. It's an amazing time for our world. There are tremendous, horrible things that have come out of the coronavirus pandemic, but there have also been some victories. And one of the victories is how we've really come together as a world to produce vaccines to beat this virus down. And I am mostly going to focus on the vaccines that are available or are impacting America. There are some across the world. China has quite a bit of development. So does Russia, and I won't touch on those as much, although this website does go and touch on those as well. And so you can see across the different phases. Those of you that are not familiar with the way that drugs are developed and vaccines fall into the same category, phase 1 is really where we're testing animals and doing safety. And then as phase 2, we're starting to enroll human patients, but very small numbers of them. And then phase 3 is where we do larger numbers. And with this particular vaccine development. It's tens of thousands of people that have been given these vaccines at this point, and so then at that point, then they are usually authorized and approved after that. So again, this isn't all inclusive because there are a few live attenuated viral vaccines that are being made, but the main ones that we're looking at here in our country fall into one of these three categories. And so what you see across the top is your protein-based vaccines. Those are where we use part or all of proteins of COVID-19 and use those to mount a memory response and antibodies against the spike protein of COVID-19. The viral vector is using a virus that is not COVID. It's a different virus that is inert. Adenoviruses are very common for this, to carry parts of the COVID molecule in and have our cells start making that protein. And then once they make that, then it's expressed and antibodies are made against that. And then the one that is very new technology that is very exciting is the mRNA vaccines that have come out first. And these actually code for the spike protein on COVID. So we actually have a way of getting the mRNA into the cells, and then our cell's own mechanism reproduces and codes for that protein, which is then produced and creates this immune system response, so that when the wild type virus actually we're exposed to, we've seen the spike protein, which is really the hallmark piece that you can kind of see sticking off that virus, and very quickly we mount that immune response and we kill it off before we get infected by it. Okay, so I want to look at each one of these in a little bit more detail. As I mentioned, the mRNA vaccines, these were really the first ones to come out. And in fact, there was a little bit of concern about these only because the technology is new. And I have several soapboxes as we go through this pandemic, and I really feel very strongly in my role of promoting vaccinations about the world getting vaccinated. So I looked into this very carefully. I think one of the major concerns that people had was that, you know, our cellular building blocks are DNA, correct? So would this somehow interfere with our DNA and cause mutations and cause our bodies to kind of go havoc? And I think the very first thing to take home is the fact that mRNAs are very different from DNA. They are not going into your cell nucleus. That's where our DNA is housed. So there isn't a chance of the mRNA getting integrated into our DNA. There have been DNA vaccines studied and there have been mRNA vaccines studied before these came out. So there is this idea that these are brand new, and that is actually not the fact. There was a rabies vaccine. There was a flu vaccine in Germany that used the mRNA technology. And so we do have some experience with these vaccines. They are newer, and certainly this is by far the largest scope that's ever been done. But again, if you go to that website I introduced, you would not believe how many different vaccines are following this path. I think when I looked this morning, there's around 15 different companies going down this mRNA route. And I firmly believe that this will revolutionize vaccine production and really how these things are made from this point forward for the rest of history, because you're able to really customize vaccines that are very, very effective and are made very efficiently. And so we want our long-term 10-year data to show that they're safe. mRNA is naturally cleared out of the body. There's these exoribonucleases that cleave them and degrade them and break them down. So they're not sitting around for years and years doing this once we're not as worried about this particular virus. And so they are known to be safe. And I think that's one of my other soapboxes, which is that there is a very big concern about the speed of the delivery, the development of all the vaccines, right? And so there's a question of, well, we're all rushing so much. Is there a risk there? And yes, there is a risk, and the risk is a financial one. And basically the country and our tax dollars have gone behind this development. So usually a company takes several different breaks in their drug development phases to evaluate whether it's fiscally responsible for them to continue on. So if a drug has problems, or if it's showing that it's not going to do what you want it to, you want to cut your losses before you've produced huge amounts of money to put into the development. And that's the step we've really skipped. We're actually producing them on a large scale, assuming that they will be effective. And if they're not, then we're out a lot of money. But that's really the risk. It's a financial risk. It's not a safety risk. When you go and look at the safety data for all of the vaccines that have been developed, we've actually given them to more people than all of the vaccines before these because of the ability of this financial backing. So yes, it was very quick and amazingly so, but I really want to get the word out that it's not safety that we're sacrificing by doing that. It's really this financial risk of, well, if it doesn't pan out, we could be out millions and millions of dollars. And in fact, we've seen that with a few companies that haven't panned out. So I kind of went into the mechanism. You can see the figure here. The mRNA goes into the muscle. It enters into the cells, and then in the cells, not in the cell nucleus, but in the cell cytoplasm, it basically translates the mRNA into the spike protein, which is then displayed, and we make antibodies against it. And so then when we see the spike protein of COVID, then we should react to that and really have a robust response, which is why many people will report that second dose being much more impactful in a negative way, having a lot more side effects than the first dose, because your body has now been exposed, whereas before it was, in most cases, it was naive unless somehow you were exposed to COVID. The first dose, most everyone does fine, but many people on the second dose do have some side effects, some fever, some aches, and some fatigue. And that's because now you are mounting your body's response. To be clear, you're not getting sick. It's inactive vaccines. Inactive vaccines will not make you sick, but they will stimulate your body's response. And your body's response is a fever and lethargy and some of these things that we experience. And so it's your body's own immune system that causes those symptoms. So moving on, the second one is the viral vector. And I mentioned this one, the Oxford AstraZeneca is one example of this that has now been approved in the UK, and we anticipate it being approved here probably in April. AstraZeneca is actually also working with the Sputnik 5 developers. So if you remember back in December, Russia developed one of these viral vector vaccines and actually started administering it. At the time, they received quite a bit of criticism because they really skipped over phase 3. They had not given it to a large scale number of people. And it's important that they had done that. However, they really felt that it was safe. And now there's actually numbers out there that shows that it was pretty good. And so, so based on that, they are going to work together to continue to develop these. But Johnson & Johnson is another one that Janssen is the company making that one. That one is a 1-dose vaccine, although they are now studying it in 2 doses just to see if the efficacy is higher. That has actually gone up for the FDA emergency use now. Last I saw, it's about the 3rd week in February when the FDA will sit down and evaluate that vaccine. So the ship date for that one is really early March. And what I didn't mention is we know with the mRNAs, the storage on these is they have to be very, very cold stored. And so there's a very tight window on when all the vaccine has to be delivered, whereas with these viral vectors, the storage in the refrigerator is much longer. And so the feasibility of getting them to areas that don't have these sub-zero freezers is much better. And the idea of getting them into pharmacies and really spreading them out across not just our nation, but the world in places where they don't have the ability to store these really, really cold vaccines is something that's very, very important. Part of the problem that I see is the media has really seized upon this whole project, and because of that, they like to highlight the percentages and studies and everything. And we know that both AstraZeneca and Johnson & Johnson are slightly less effective than the first mRNA vaccines, but that does not mean you should not get them. One of the things I'll talk about in a minute is some of the variants we're seeing, and they're still very, very effective against severe disease. And remember, the flu vaccine isn't always very good at preventing the flu, but it is very good at preventing the hospitalizations and deaths from the flu. And it's the same idea. It's okay if you end up getting sick. We don't want you on a ventilator and in the hospital and potentially dying from COVID. And that's really something that all of these vaccines are very good at preventing. And it's extremely important that everybody get vaccinated so that we prevent these new mutations, these variants from coming out, because that's where we run into some issues. All right, so I mentioned that some companies have already stopped development. Merck, this is an announcement that happened just at the end of January, where because of their efficacy not reaching what they wanted it to, they just decided to discontinue the development and focus on some of the therapies to treat COVID itself. And you're seeing that on that website. You'll see a number of companies that have actually halted development based on that, or at least delayed it. All right, finally, the third group that I'm talking about is this protein base. So this is not new. We've done this for the flu for a lot of years. This was the H1N1 response. You put an adjuvant with the protein. So the protein is either part of COVID. In this case, it would be the stock or fragments of it. And then you use something else to really boost your body's response to it. That adjuvant really boosts how much your body responds to the protein so that you get a very robust immune response. And this is how we have done Shingrix, the shingles vaccine, the newer one. Any of you have gotten that? A lot of times you'll say, yeah, I had some side effects in my shoulder when I received that one. It's the same idea. The adjuvant really boosts how much your immune system responds to the protein, and therefore you get a very robust response, but it does come with some side effects. So a sore arm and some local site reactions are very common, and you would see that. Examples of this would be the Novavax, which has data now from phase 3 from the UK. They actually had trouble getting their US trial started, so they're delayed there, but they're trying to convince the FDA that the UK data is good enough. And if so, then they will actually be approved based on that. If not, they'll have to finish their American trial. Sanofi actually had some disappointing results initially with their adjuvant protein combination, and they're varying that to become more virulent. And so they're delayed until late 2021 or even beyond at this point, but are still very much working on it. All right, so I want to wrap up my section of this talk by talking about where we're at as far as thinking about these things. We've already talked about storage, right? And so all of the vaccines that are not mRNA are much easier stored and distributed. So that's really going to help us when it comes to getting people vaccinated and not having to give it all within a very short period of time. There is a little bit of discussion around whether the mRNA vaccines are interchangeable. At this point, the recommendations are if you get one mRNA, if you get the Pfizer one, stick with the Pfizer. If you get Moderna, stick with Moderna. But if there was a shortage, they are so similar, and there's more coming out, that in the future, you might see a recommendation where they might allow you to get a different mRNA type of vaccine. Make sure that you don't get confused, though, because if you got one of these completely different technology, like the viral vector or the protein base, you have to stick with that same type of vaccine. You can't change from an mRNA to a viral vector because they're completely different in how they work. So the rule of thumb is really to stick with the same one whenever possible, and that's what we're working on. The efficacy of Johnson & Johnson's came in right around 70% overall. Again, I caution you to not use that to say I don't want it, because we have had, I've actually heard from my family where there's a provider, a physician, who said, well, I'm not going to even stock that vaccine. Why would I give that to my patients? And that's absolutely the wrong approach there. It's negligent to have that attitude. You need to stock whatever vaccine you can get. It's very naive to think that we will continue to be able to get Pfizer and Moderna vaccines at the numbers that we need them in order for us to get back to work. Pediatrics is a concern. All of us that have kids, when is that coming out? I can tell you all the companies are planning on doing that now. I know that Pfizer actually started that study from 12 years old and older, starting in December. And so we will have that data sometime this year. And then finally, I keep talking about variants. And at this point, we have 3. There's one out of Brazil, there's one out of South Africa, and there's one out of the UK. And particularly with the South Africa variant, you are seeing the vaccines less effective. They are effective, but they're down towards around 50%. And so we're looking, number one, at severe disease, and number 2, the companies are able to change their vaccine development to match the new stock protein, which has mutated, and they're actually catching up and producing these variants, so you'll have a vaccine specific to that one. So in South Africa, they actually stopped the distribution of the AstraZeneca vaccine because of the lower efficacy, and they're making a new one. But I want to talk about variants because the reason variants are happening is because people are sick. And the way that we get people not sick is to vaccinate. And these variants will continue to crop up, and we'll continue to see this virus change and mutate until we get a mass number of people vaccinated and no longer sick. And then you're not going to see nearly the number of COVID out there. And that's really what's driving these variants to happen. And so getting the word out to vaccinate, to as soon as you're able to get your vaccine, no matter which one it is, get covered. It looks like it could be a yearly thing for us now. And so it's something that is certainly with us. And I encourage all of you to get vaccinated as quickly as possible so that we can stop the spread and stop the variants from happening and get back to some semblance of normal. I'd love to go back to a movie sometime, maybe not this year, but sometime. And so I look forward to whatever our new normal is. All right, lots more I could talk about, but I am sensitive of time. So I'm going to transition here to Monika. I'm going to stop sharing my screen and I'm going to transition and Monika, take it away. Monika, you're muted.
Thank you, Wes. So before we move to the second part of this presentation, we're just going to do a quick poll to get an idea of the audience. So please indicate what's your most appropriate affiliation. And this will help me tailor the second half of this presentation. All right, we'll give it a couple more minutes. All right, great. So now we're going to talk about, thank you for sharing those results. We have a great representation of School of Pharmacy, Nursing, Medicine, faculty and staff. So we have a great diversity here. And that's awesome because this impacts everyone. And I want to talk about different health strategies that we can incorporate. So what exactly is integrative health and medicine? What are these integrative strategies we can do? So to make sure we're all on the same page, I want to talk about a definition. And there's a lot of information in the literature, and unfortunately, we don't have a clear definition. But if we take all the information, we come with two key pieces. First of all, integrative health and medicine is a healing-oriented practice, and it is a relationship between a provider and a patient or a person. And the whole person is critical. We're looking at the mind, body, and spirit. In addition, we look at the evidence to make appropriate recommendations. Now, in the past, you may have heard terms like complementary and alternative medicine. It's just terminology, right? It's a relationship between the provider and the patient looking at the evidence. So here I provided a depiction of some of the different modalities that would fit under integrative health and medicine. And sorry about that. You may be familiar with some of these. I'm sorry, I'm having technical issues trying to get rid of all my little screens here. You may see some of these modalities and others you may not be familiar with. What you'll note is the biological based in red, the herbals, the supplements, the therapeutic foods and diets is the highly utilized, but not to say that these other modalities would not benefit and could be strategies today. But I want to start off with right away that currently we have no integrative interventions that have been validated in human trials for COVID. So really we should end our presentation because there's nothing I can tell you will work to prevent or to be used while having those symptoms. But that's not fair. I think there are things we can do. And in particular, I want to talk to you about what you can do to reduce your risk and increase your immunity. With COVID, we're noticing more and more issues in addition to what we're familiar with. Some of the things include lack of exercise. So we're now, 6 weeks into the year. How many of you consider New Year's resolution of exercising more, being more fit, eating well? Absolutely. How many of you are still continuing that process 6 weeks in? It's very hard. But also with COVID, what we're experiencing that a lot of the gyms and the studios that offer classes are closed or have limited capacity. And not everybody is motivated to stream a yoga class and pull out the mat and do this at home. Also, we're not eating the best. And there's multiple reasons behind that. How many of you are now working remotely where that refrigerator is just a few feet away? You can eat whatever you want, how many times you want, maybe not the best choices. And our eating habits could be out of boredom because we're at home, or even due to stress with everything with this disease and eating unhealthy. We may be working out of the pantry, the freezer, or taking advantage of Uber Eats. Maybe picked up something from the drive-through that maybe isn't the best. We are not where we were, where in the summer we had farmers markets that provide great fruits and vegetables that are great quality. Our patterns have changed and often have been unhealthy. We're also seeing sleep disorders, all the stress and pieces that are occurring in our day-to-day lives. We're also seeing it go into the evening and impact how restful we are. And of course, mental health symptoms are occurring. Those that have some baseline mental health conditions are having exacerbations because it's very challenging to do it. What about our even keel folks that now are having some stress and anxiety and maybe even depressed? Those are things we need to also look at to reduce our risk and increase our immunity. So my goals today is to foster resilience, provide you guys with tools of things you can do that is effective and puts you in charge. The protocol or the recommendations are going to vary person to person, depending on what you need to address. Now, as I stated earlier, no real studies have been done, but sure, there has been publications looking at different treatment options. And here are the 7 buckets: nutrition and vitamins, mind-body medicine, positive attitude to life, exercise and nature therapy, aromatherapy, sleep medicine, and botanicals and phytomedicines. So let's go through each of these, just tackling them briefly. So first of all, nutrition and vitamins. If we have a diet rich in antioxidants and anti-inflammatory nutrients, we'll be in better shape. And that's looking at a variety of produce, those fruits and vegetables from the rainbow, giving us all those nutrients. And it's recommended that 5 to 7 servings of vegetables and 2 to 3 servings of fruit. So I ask each of you to honestly think back the last 24 to 48 hours. Did you meet that goal? Some days, but maybe not all. So we're not improving our immune system. But no worries. Studies have shown if you increase your fruit and vegetable intake by only 5%, there has been a shown of 12% lowering of hospitalization due to influenza infection. So maybe next time you need a snack, grab an apple instead of those potato chips. And there are other components. We're looking at hyper and hypocaloric status. We talked about the hyper, right? Eating too much, not appropriate. But the other side of the coin we don't think about, but we need to, is the hypocaloric. How many folks are laid off, furloughs, unemployed, maybe are having to utilize food banks to figure out how to put the next meal on the table? And those food banks aren't able to meet the needs of all the citizens. So maybe decisions are made that may not be the most appropriate for health. We do see that there are vitamins that are beneficial that have immune response, things like zinc, vitamin A, C, D, and E. Now, I'll honestly say that if you have a deficiency, you need to address it. But how much should we take in to see that benefit? And are we talking about a supplement, or should we look at our diet? Now, it is known that if your vitamin D level is deficient, you need a supplement. And I can't look at you to say, hey, you have high and you have a low. We only know this by doing blood work. And we have some great parameters for overall bone health to prevent osteoporosis. But if we're talking about vitamin D kind of to decrease our risk and increase our immune system, we are pushing an intake much higher and double to triple the amount of intake and kind of that nice number that we're looking for to give us that benefit. But don't just look at supplements. Look at food as medicine. We have some basic items the food banks offer, as well as affordable options that have some great properties that is going to give us nutrition. Onions, apples, tomatoes, orange nuts, and berries. Now, not all of those are seasonal, but there's some good options. And for those of you that like to cook, we have culinary herbs that have medicinal properties that can benefit you. Things like parsley, garlic, ginger, celery, and thyme. If you still have a garden, if you're a good seasonal part of the States and you can enjoy it, maybe like today it was pretty cold. So even those dry herbs can give you some benefits. What about mind-body medicine? Well, exercising and relaxing and meditating is important. Looking at stress reduction interventions to make you have that balance. That's one of those key modalities that keeps us grounded. How do we do that? Strategies include things like meditation, breathing exercises, mindfully breathing, doing biofeedback or heart math, even guided imagery. And studies have even shown doing yoga and qigong has not only exercise benefit, but also that mind body. Now, that's easy said than done, right? I mean, who could turn off that brain and do the meditation? The picture looks great, but for those of you who have ever tried, it's hard. Well, I found a very interesting picture that came up on my feed I wanted to share with the group. So this person ordered a meditation book off of Amazon. It was called The Guided Meditation for Beginners. And every page said inhale and exhale. All right, so we could all do this, right? We could take a deep breath or not. If we had more time, we'd maybe even do a little exercise. There's many ways. You don't have to be perfect. You don't have to wear the right clothes. You don't have to be in the best place. Anything to kind of have that balance. Take a few minutes for yourself and do some deep breathing or meditation. What about our positive attitude to life? Well, you know that stress and anxiety can really impact your attitude. Having a positive attitude is important. Are you the glass half full or half empty? When you have that positive attitude, what we see is that we could decrease our risk factors for cardiovascular disease and all-cause mortality. If death doesn't do it, okay, have a good attitude. It's going to limit that. And you're going to overall be more resilient, feel in charge. So we have a good attitude and we want to, spill that cup over into our relationships. With COVID, due to quarantine, safe at home, stay at home, all kinds of different kind of rules, patients and family members and folks are feeling isolated and lonely. They're not doing what they normally do. I mean, look, the Nuffers here are having a date night. It's great. We have something to do together. But we want to develop strong relationships, and it's going to overall lead to better health and perception of health. How do we do it? Studies have shown that maintaining communication with important ones are very critical, right? We're in the age of technology. You can text, you can Zoom, you can Skype, you can send a letter, you can phone call. Any kind of appropriate safe distancing communication can help keep those relationships. But not only keep in contact, but we've also see that whole person, that mind, body, and spirit, looking at affection and gratitude. Share with ones what is important. You just don't know what tomorrow will bring. Now let's get out of the philosophy and get into something light. Humor and laughter is a great component. Watch a funny movie, get a good laugh, tell jokes, or maybe watch, read the funnies, right? Those still exist. If you forget, let's do one right now. So here on the left, I have a couple aliens in a spaceship, and they have toilet paper in their spaceship, and they say, "Our leader will be pleased that we obtain the most valuable resource." On the other side, you have socks going on a field trip to the laundromat, and the sock leader says, "Stay together, or you'll end up as toilet paper." I hope I have some chuckles. Can't see all your faces, but I hope that at least there's a little smile, and we've addressed that issue. Why am I talking about toilet paper? Because you all use it. All right, let's shift gears. What about exercise and nature therapy? I have to give you an interesting stat that was alarming to me. It actually stated that in 2050, 66% of the population is projected to live in cities. And what was even more shocking is the average American spends 93% of their time indoors. Who has kids or teenagers? Or maybe yourself. That's a lot of screen time, right? So we need to look at how we can exercise and enjoy nature that can give us that balance, get us more resilient. So when we don't exercise, we're going to have an increased risk of infection and complicate those chronic conditions that we have. We know that 5 to 10% weight loss is going to provide some healthy benefits. We see it helps our blood pressure, our endocrine system. It makes us happy. We have a better mental health system. Our immune system is stronger. We just feel good. How do we do this? Well, the first option, we definitely can exercise. And we're all familiar, right? Whether you're doing aerobics, you go to the gym, you do yoga, tai chi, all those things. Fantastic. But what I want to focus is maybe of the things that we don't always think about, nature therapy. Nordic walking is one. You've heard of that, right? Lace up the shoes, head on out, but you use specialized poles to walk where you're increasing that exercise. That's a year-round sport. You're outside, you're getting fresh air, you're getting some vitamin D, especially if you're deficient, that's helpful. And you're just enjoying nature. That's an all-year sport. If you are in the winter season or certain locations, cross-country skiing is a similar example. What about forest bathing? Yes, I said forest bathing. I'm not saying we're going skinny dipping into the little lake in the forest. No, no, that's not that kind of show here. What I'm talking about is really enjoying nature. Forest bathing came from Japan, and the thought is to be outside in the forest, enjoying that environment with all five senses. But you may say, well, but Monika, you said that most of us live in cities. There's no forest beyond my eyes. No, there isn't. Even going to gardens or parks with trees have provided some good benefit. So entertain this. I'm going to play a very quick YouTube video, less than 2 minutes, explaining forest bathing, what it is, how it works, why you should do it. So just relax, please be present, read the captions that kind of describe that. Let's try that one more time. Wow. How many of you feel just a little relaxed right now? I do. I feel like I need to go for a walk after this talk. So the other component I want to talk about that's looked at in the literature to improve your immunity is aromatherapy. Aromatherapy is essential oils that are derived from plants through a variety of mechanisms of extraction, distillation, and so forth, that has chemical constituents, and we won't go into all those terpenes and terpenoids that are beneficial, that based on its chemical makeup have a mechanism of action to address multiple areas, no different than our herbs or even history of prescriptions. So we look at essential oils that suppress the inflammation and prevent infection, and that can help reduce our risk. Now, in the papers, they didn't go into great detail of which oils would be beneficial or not, but I wanted to share some just to kind of give you kind of a list. Now, these are not all inclusive. This particular list looks at essential oils, more common, not as obscured and hard to access or pricey, but oils that can have an affinity for the respiratory system. Now, recognizing that these are complex structures that can tackle not only antiviral, anti-inflammatory properties, and so forth. So here in the bold is the common name, to the right is the Latin botanical name, because we do want to make sure that we're using the right product. We don't have time to this presentation to go into great detail, but just keep that in mind that we have another tool in our toolbox that can help reduce our risk and increase our immunity. What about sleep medicine? Please don't fall asleep during this time. If you did, maybe you need it. We know that when we don't get enough sleep, our body's just as an increased risk for illnesses, for infections. And some of the studies state that we should get at least 7 or more hours of sleep a night. I kind of question that. I don't think about the quantity of sleep. I look at the quality of sleep. Do we wake up restful? The piece that we notice that when we have good quality sleep, our bodies will naturally release melatonin, a chemical that's made from our pineal gland that is essential to help us have good sleep. And as we get older, we make less of it and we decrease its secretion. So we do want to have good sleep. Studies have shown that if you get 5 or less hours of sleep over a 7-day period, that there was an increased risk of rhinovirus by 350%. Wow, let's just get some good sleep. Well, now I'm going to give you some strategies. Now, that's not going to really apply to those that have insomnia and other underlying conditions. But let's just say for us dealing with COVID and stress of life, what can we do? Well, we have to talk about sleep hygiene, right? But it's not a fancy pill. It's strategies that we need to do. We need to be in a cool, dark room that's comfortable. You know that bed of yours? That's to sleep in and to have sex in, nothing else. So when you're in your room and, think about the days they always say, don't have TV in your room. You're not going to have a good night's sleep. Think about our technology and the portable laptops and tablets and even our smartphones, that blue light we're exposed to, even candles. We really want to limit that. So we want to kind of change our environment. Also, if you're interested in essential oils, lavender is a great oil to help with sleep. And it's the first one that was discovered for its medicinal properties. And kind of looping kind of a 2-for-1 prong effect, doing yoga and Tai Chi has provided benefits not only for exercise in your mind, but helps you sleep. Lastly, I want to talk about botanicals and phyto medicine. This is an area I think a lot of people are so excited and want to know, hey, are there certain herbs I can do? And that's very challenging. Again, remember, no studies proven to work, but there are some that are being looked at. So we have the oncololobol, it's an African herb, as well as elderflower that helps with our airway. Green tea, drinking that tea can help our immune system. The glycyrrhiza, which is found in licorice, as well as echinacea, has anti-inflammatory properties. And the Nsaids incanus has polyphenols that also might be better. But we won't go into great detail because it's very personalized depending on the whole person, what else you're coming to the table, what are your conditions, other products you're on, if this is the best product for you or not. But what I can tell you is what you shouldn't do. We do know that if you have any symptoms of COVID or you have actively COVID infection, we want to avoid any herbals that stimulate the immune system. Some of the more common ones includes elderberry, echinacea, and medicinal mushrooms. I want to provide a tool, something that's fun. So I just told you a minute ago, you can't use elderberry if you have symptoms, but preventatively, what are some things we can do? Here's a great recipe of creating elderberry syrup, including the ingredients, elderberry water and sweeteners, the recipe here and the directions. This is a great tool in your toolbox to use, fun family activity. You can make this and have a natural option to help wear off the colds and symptoms and kind of build that immunity. All right, so let's wrap up. We know that we should wash our hands frequently, often, and well. Tell my kids that all the time. Don't just run the water, but actually wash your hands. We want to be careful about our contact, right? We need a social distance. We need to wear our masks in public. And please, not only cover your mouth, but your nose too. We want to limit our travel when possible. And when you're experiencing symptoms, get tested at the appropriate time to prevent that spread. Through this presentation, we talked about all kinds of other modalities, meditation, herbs, the nutrition and vitamins, aromatherapy, sleep, forest breathing, and our relationships. And as Wes talked about earlier, don't forget to get vaccinated. Not only the flu vaccine to build that immunity, but the COVID vaccine when you are eligible and can. Please get yourself vaccinated. But as we talked about, nothing has been proven yet. We haven't done those studies. So what we need to do, we need to do research more and more about what could be a good tool to prevent or to be used during treatment. So what's our takeaway messages? Well, we have three. First of all, I would like you to follow the CDC guidelines, the Center for Disease Control, or your local health authorities if you're out and about in different areas about COVID-19, right? It's constantly changing. Make sure you know what you need to do to be protected and safe with your loved ones. The other component, maybe this is my hat that I wear quite often, is talk to your healthcare provider when you want to try any new treatment options. Whether it's something we talked about today, whether something your neighbor said, or an info commercial, or an article, journal article you read. It's important that your provider knows what's going on, what you're considering. Why do I mention this? Well, studies have shown that 72% of patients don't share what they are doing, how they're taking care of themselves with their provider. And there's a variety of reasons behind that, both positive and negative. If your provider knows what you're doing and how they best can help treat you, providing you with safe options and maybe even effective options, will allow them to provide those integrative modalities, these other treatment options outside of the traditional care. And nice thing is once a provider is aware and is either educated, finds the information, or refers appropriately, often 34% of patients do what their provider recommends, outside of just those prescriptions or those surgeries. And then lastly, I would encourage you to be a lifelong learner. You're all here joining us this evening. You are interested, you're wanting to learn, but it never stops, does it? Maybe you need a break, but it never stops. We're always learning. We're here only for an hour. We cannot cover everything in this time. And this series is excellent, looking at all kinds of healthy options to help you. I'll do a little pitch. Hopefully that'll be all right. Here at the School of Pharmacy, we have a Integrative Health and Medicine graduate certificate program. This is a 100% online program, flexible, part-time or full-time, where there's 6 courses that are completed in a fall and spring semester, total of 9 credit hours. And what's very neat about this program is that it is open to all healthcare professionals. We have physicians, physician assistants, nurses, pharmacists, dentists, and students of those respective schools. So if you want to learn more about integrative medicine, different modalities, pharmacology, and how to apply this to your practice or yourself, I urge you to take a look at the links there, phone number, email, and web. If you say, whoo, 9 credit hours, I don't got time for that. We even offer a couple hours of CE just to kind of wet your whistle and give you some good foundational information, both in how to use and practice, as well as pharmacology. All that's found there on the website. Here are my references. If you're a little interested more, the first 2 are great kind of review articles that look at integrative modalities. Unfortunately, not enough, but hopefully we'll have more in the future. So now I'm going to turn it over to Andrew. Thank you guys for your attention.
All right, well, thank you to both Dr. West and Dr. Monika. We'll now take some questions through the chat feature, so go ahead and type any questions you might have there for our presenters. And it looks like we have a few already. So the first question, if you have numerous allergies, should you take a specific COVID-19 vaccine, Pfizer, Moderna, Oxford, J&J, or are any of those 4 vaccines acceptable?
Yeah, so that's an excellent question. And I would reiterate what I said earlier in the fact of take whichever one you can have access to. There has been an association with the mRNA vaccines and allergic reactions when someone has severe allergies, like an anaphylaxis. So if you do have like a severe anaphylaxis to bees or anything like that, let your provider know. It might be a situation where you get the vaccine in a medical office somewhere where they have responders right there. We never vaccinate unless we have EpiPen right there with us. So there are people there prepared to respond to that, but you still want to let your vaccinator know that this was a problem, because there have been literature examples of allergies happening. But that being said, it's extremely rare, and it shouldn't stop you from getting your vaccine. There really is no safer one established as far as one's better than another. There's a lot of anecdotal evidence and there's a lot of rumors, but at this point, I would get whatever one you can have available to you.
Great, thank you. The next one we have is, we have children who are young adults, early 20s. They are healthy and do not have risk factors. We have been told to not get them vaccinated due to unknown risks with the vaccine. Would you disagree with this recommendation?
And I would 100%. I had this exact conversation with a friend of mine last week. He's a very young man. He's a martial artist, so he thinks that he can beat anything. And what you have to realize is that your young children probably will be absolutely fine. They'll probably beat COVID, but you never know. First of all, I had a 30-something gentleman who was in our clinic that had COVID so badly he was on a respirator for a month, went blind in one eye, and was very severely impacted. So this is not just an opportunistic disease. It can impact young people very severely. But additionally, and this is what I told my friend is that you have to keep in mind all of the people that those people are exposing. And so even if you are going to make it through without being sick, you are around a lot of other folks who may not be as young and may not be as healthy. And we are all depending on each other to keep each other healthy. And so unfortunately, that is a very common thought of, oh, I'm fine, I don't need it. And even within regular vaccinations, we see it a lot. But the only way we're ever going to get past this pandemic is for us to have 70 or 80% of our population protected, because we are all needing to cocoon those around us that are more susceptible.
Great. Another one here. Is there decent data behind Reiki? How does it work or not?
That's a good question. And that definitely, Reiki fits into one of those modalities that has been used. It's typically provided by a teacher that has learned from their master, from their teacher, where they have been qualified to provide that. It is quite prevalent. We do have some great folks even here on campus providing those services, and it is something that we do cover within our curriculum. I'm not trained, nor am I an expert in that piece, but it is a great mind-body modality. Is there evidence for it? Well, as I stated, unfortunately, there's just no evidence in anything of these integrated modalities for COVID. But overall, for just wellness, it is a great option. Everybody's different. You know, if you look at Reiki or yoga or Tai Chi, maybe the more familiar modalities, it may not be appropriate for all. So it's really trying to find what works for you, what type of meditation, what kind of physical fitness you have to be able to actively participate in the technique that's there. But I think the challenge becomes with Reiki is finding experienced and reputable providers. And so there are some great resources. And if somebody would like to send me an email offline, I can connect you with Michelle Cordarelli. She's here on campus and she's a Reiki master and teaches within our curriculum and can give you good resources of where you can obtain those and maybe even some of the informal research being done for wellness, as well as that decreased risk reduction.
Great. So another one here. I've seen a lot of conflicting data about taking Nsaids before the vaccine. What is your take on that? We'll go ahead and get an answer on that one, and there's a second part to that question.
Yeah, so I wouldn't necessarily take NSAIDs before your vaccine, just because everyone responds a little bit differently. And there's still my endocrinologist. He's upwards of 70 years old, and he got both vaccine doses and didn't have a problem with either one. And so I don't think there's necessarily a need. Is it a problem if you're taking an anti-inflammatory as far as how the vaccine works? No, it's really not something that's established to interfere with your immune response. Anytime that you take an anti-inflammatory, inflammation is part of that immune response. So there's a thought of, well, are you mitigating some of that? Generally speaking, I would probably recommend Tylenol as your first option if you needed to take something for fever, just because it is that antipyretic and it doesn't have the anti-inflammatory effects. But again, that's really not going to be an issue with how the vaccine works overall. So I would say that I wouldn't pre-medicate, but I certainly wouldn't be afraid to post-medicate if you start getting symptoms.
Okay, great. And the second part of that is for Dr. Monika. Is there anything you would recommend non-pharm for mitigating some vaccine side effects?
I think overall, just kind of being healthy and wellness, right? Make sure you're not dehydrated, that you're well fed, that you're prepared. And maybe for some of those with phobias of injections, right? Do some mindful breathing before, get at that distraction. Integrated modalities is definitely one avenue, but it is overall kind of the whole picture of wellness. And so, not just for prior to getting the vaccine, just in general, those things are easier said than done. But practicing prior and when needing, you'll be successful. So taking a deep breath, trust the vaccine will protect you, trust your vaccinator, whoever that may be, and recognize the benefit it will serve later on.
A couple more here. What does an integrative health workforce look like today, and how will that change in the future?
Oh, I hope it does change. Integrative health provider can be a traditional trained practitioner, personally interested, or seeing patients that use these different modalities. And as a provider, it's important to be open to that whole person health. There is a time and a place where a prescription or surgery is appropriate. Sometimes we need to look at our non-pharmacologic, that's the pharmacist in me, right? What's the self-care? What are things we can do that maybe prevent us from getting to a point of needing a prescription? And then, of course, if you look at integrative, then it kind of goes into that picture I described beyond just diet and vitamins, but these other modalities, other disciplines like Ayurvedic medicine, traditional Chinese medicine, really following that practice. And providers are either trained to provide those services, have knowledge and know where to find answers if patients inquire, or at the very least, if uncertain, unbelieving, can refer to somebody that is trained and can provide that whole care for our patients. Because if we're not open minded as providers, then our patients will continue to not share what they are doing. And in the end, that can be very dangerous for their overall care when we're missing a piece of that puzzle. So that's where integrative. Where's the future? More accepting, more trained, covered. A lot of this is out of pocket services. We may not mind to take a yoga class and pay out of pocket. We may be pleased that our insurance has approved chiropractic visits because we were in a car accident. But there are other modalities that we are having to pay out of pocket, and we really need to look at the reimbursement for the services we provide, especially if it's not only a trained traditional practitioner in that modality, or also somebody that has that allopathic training and can combine both the East and the West. Maybe East and West is wrong, depending where you're at, but really combining that whole person. So I hope that we'll all be accepting and think it's a normal thing. Not only ask what prescriptions and allergies you have, and are you up to date on your vaccines for today's talk, but are you doing something else that I need to know? And making sure that everything you're doing is safe and hopefully effective.
Thank you.
That's a bit of a soapbox. Sorry about that.
No, thank you. We're running a little short on time, so we'll take one more. Are you susceptible to COVID between the first and second dose of the vaccine?
Excellent question, and the answer is you are susceptible. After the first dose, you need to have about 2 weeks, and after those 2 weeks, you have some level of protection. And so I remember when I got my first dose that I was counting the days because you can feel pretty confident that you have some good coverage after 2 weeks. However, you're not fully covered on a 2-dose series until you get both doses. And so that second dose is where you really get the longer lasting response and the higher percentage response. And so it is still a risk. And there's always a risk that you get exposed when you go in to get it or before you even got it. And so there are all sorts of anecdotes where people are getting vaccinated and still getting sick. And so again, I think it's important to remember that it's preventing severe disease, and every day after you get your vaccine, your chances of having severe disease that could really kill you goes down dramatically. And that's really what we're trying to do at this point is prevent the hospitalizations and death. So yes, there is some risk there, and you want to make sure and get that second dose right on schedule.
Great, thank you. So sorry to those questions we didn't get to, but we'll need to wrap up. So thank you all for your time this evening. Don't forget to connect with us on Instagram to check out stories about your fellow alumni, or at our newly launched CU Anschutz alumni LinkedIn group focused on professional development. Stay tuned for information regarding future happy and healthy hours, the next of which will take place on Wednesday, March 10th. And just thank you so much for tuning in and all you do as healthcare professionals for your campus and community. Thanks.